Hi everyone. Today I would like to speak on the subject called febrile fits or seizures or epilepsy in the context of fever, especially children from the age group of 6 months to 5 years of age. They get a generalized fit, something like clonic jerks and stiffening of the limbs with fever. The fever may be around 38 degrees centigrade, that means 100 degree, 100.4 Fahrenheit. It can vary, maybe from mild fever to moderately high fever. So this runs in families, maybe in 30% of the families, they in the siblings or in the offsprings, they can have seizure. This is much more common in the boys compared to girls, and it said that 2 to 5% of the population or the young kids can have this sort of a seizure. In Japan and all, it has been reported up to 10% of the population. So it said that these seizures occur in the absence of any infection, no meningitis, nothing, no problem related to the brain, like some malformation in the brain, no damage to the brain, no infarcts or some other problem in the brain, and there is no electrolyte disturbance like low sodium, low sugar, low calcium or other neurometabolic abnormalities. They just occur in the context of fever. And pre-morbidly or before getting fever, the child is perfectly normal, crying, playing, doing all sort of activities without any brain symptoms. Okay, so naturally you would think that, oh, we should treat all these patients with anti-epileptic medication. The answer is no, don't treat this. You don't have to treat it. The only thing you should reassure the parents that this is quite normal. There is no chance that this would become an epilepsy in later life, and the chance of getting a low IQ or a subnormal intelligence or cognitive decline or behavioral abnormality is extremely rare. It's been never reported. But there are two types of febrile fits. The first one is the simple febrile fits. This is characterized by a generalized fit. This would last from 1 minute to 3 minutes, rarely up to 15 minutes. And this would occur once in 24 hours, and after fit patient or the kid gets up within a matter of few minutes, and there won't be any residual weakness like stiffening or hemiplegia or something after the fit. On the other hand, there is one more entity called a complex febrile fits. This would manifest as a seizure or epileptic focus or epilepsy occurring from one side. This is called focal fits. That is, instead of a generalized fit, they would get a focal fit, and this would last for more than 30 minutes. Instead of the less than 15 minutes, this would go on for maybe half an hour or so. In that case, you should immediately call the ambulance or take him to the hospital. Thirdly, this will be prolonged postictal confusion or coma. Instead of getting up immediately after the so-called fits, the kid would be like in the motionless state for hours, maybe half an hour, 1 hour or so. And sometimes there can be a weakness. It can be weakness or a hemiplegia or a facial deviation. This is called a complex febrile fits. So these people, those with the prolonged seizures or who gets this sort of a multiple seizure in 24 hours, they are likely to get some complication, may get some complication in the later life, maybe some hippocampal sclerosis, some scarring of particular part of the brain. Some of them might develop a seizure, but it's not proved. And rarely some of these people can have, or this person can have some mild behavioral or cognitive dysfunction later on. But generally speaking, febrile fits are harmless. You don't have to treat it. In the context of a fit, just like what you do when the patient goes in, don't suppress, don't give pressure to the baby, let him have a fit, don't worry at all. So maybe within a minute, maybe within a half minute or 1 minute, if it is continuing, if there is a gurgling sound, you can gently turn to one side, don't push, don't suppress it. Okay. And thirdly, if it lasts more than maybe 15 minutes or so, immediately take him to the hospital and do the necessary things. And sometimes at home also you can do certain things called, you can give as per the advice of your doctor, you can give rectal diazepam or intranasal midazolam, or you can give a tepid sponging with a cold water, but you shouldn't do that in the context of a fit. Always when the child is getting a fever, you can start using that. You can use a paracetamol syrup, and if the seizure is getting for the first time, should be careful. Sometimes, you know, sometimes they can be, rarely they can be a problem in the brain called meningitis or some infection to the brain. So it is of utmost important that the first if the child gets a fit for the first time, you have to evaluate for any underlying pathology like a meningitis or electrolyte imbalance or some problem. Okay. As I mentioned, this can run in families. There are multiple loci are available. So 1Q, 2Q, 5Q, 8Q, 12Q, 19Q, like many many loci were found, and so especially sodium channels has been invoked. And there are certain syndromes called Dravet syndrome and generalized epilepsy with the febrile plus syndrome. There is a different types of epilepsy. That would cause multiple fits later on with many other complications. But those are not related to febrile fits. But the epilepsy may be induced in the by fever in this sort of patients. So if the child gets a fit for the first time, always rule out that there are no other underlying pathology. But usually in say febrile fits, the kid will be perfectly normal. He would be running about, no behavioral abnormality, no cognitive, memory, IQ disturbance. So naturally you don't have to do a MRI or a EEG or the test. Just reassure the parents that it would go after some time, maybe in a matter of few years. In case if you feel like he is getting recurrent fits, you can give a prophylaxis. Even as per the ILA, International League Against Epilepsy, and other expert group, it said that it's not required. You don't have to give even a prophylaxis of benzodiazepine and never continuous anti-epileptics. That's not required. I haven't given any long-term anti-epileptic medication for any of my febrile seizure patients. So I would mainly reassurance, and if they have, if they're really concerned, then we would give prophylaxis during the episodes of fever, maybe for 2 to 5 days of a low dose of benzodiazepine. Otherwise, if the parents could manage at home with some sponging, maybe some supportive care, maybe the rectal diazepam or intranasal midazolam, that's fine enough, that's well enough. You don't have to give a long-term anti-epileptics for these patients. So why I want to stress this point is that generally people would think that, oh, my kid is getting a fit and he would develop a epilepsy later in life. It is unsounded. I mean, that is unfounded. This is not proved. So you can relax. Your child or it is likely to get a febrile fit. You don't have to worry. Just give some sponging, maybe paracetamol, and you don't have to give a long-term anti-epileptics. So I hope I could give you a brief idea on the febrile fits, the various types of febrile fits, the various manifestation, various genetic issues, as well as the various differential diagnosis, the treatment options, the prognosis, and other factors. So I would give you some some website or maybe some contact support groups. You can contact them maybe if you have any concern on this particular aspect. Thank you very much. Bye.